Hello and happy Pride. Thank you for joining us today for our Pride Conversations. I am Admiral Rachel Levine, the Assistant Secretary for Health at the United States Department of Health and Human Services and the head of the United States Public Health Service Commission Corps. And I'm here today with my colleague Melanie Fontes Rainer, who is the Director of the Office of Civil Rights at the Department of Health and Human Services. Thank you for joining us today.
Thank you so much for having me.
Oh, looking forward to this conversation. So can you tell us what is one LGBTQIA plus topic that is important to you?
Sure. You and I talk about this all the time. We travel across the country. We talk to a lot of families. And we know that a lot of folks can't access the healthcare system without feeling bias or discrimination, or just they're too scared to go. And so for me, a really, really important thing I focus on is making sure that people can access our healthcare system. And so whether that's through civil rights regulations, whether that's through protecting their privacy, that's one of the really big focuses for me in my office.
Well, thank you so much for outlining that. It's very, very important. Now, with your Office of Civil Rights, I know you recently finalized new rules to advance non-discrimination in healthcare. Can you talk about the importance of these new rules and their significance to access to care for LGBTQI plus people and for people living with HIV?
Sure. So again, you and I have talked about this so much, and so it feels very natural that you're asking about it now. But we have a lot of new rules. One is Section 1557 of the Affordable Care Act, non-discrimination in health programs and activities. That rule importantly says that sex discrimination, so discrimination on the basis of your sex, includes sexual orientation and gender identity, including intersex traits, as well as sex characteristics. It also importantly makes clear that you have equal treatment under the law, meaning you cannot be denied health care and you cannot be denied health care coverage. And the second rule we talked about a little bit is about disability. And so making clear that you can't discriminate on the basis of disability. Having HIV can be a disability. And so it's an important part of the rule that we have a specific provision that says you cannot be treated differently because of your disability. You cannot be treated on a basis of a stereotype or a bias, which we actually see a lot in our enforcement work, where someone might treat someone with HIV differently because of that healthcare status, which might lead to worse health outcomes, poor treatment. And so that's where the rule is very clear. And so we just want to make clear that to all of the hospitals and other covered entities out there so that they follow the law and people can get the health care they're entitled to.
Well, thank you so much for these important rules and regulations through your office and all of your staff. I know this was, as we say in Washington, a heavy lift, and it just took an enormous amount of work, and they're so important, as you outlined. OCR also recently updated its complaint portal. What should LGBTQI plus people know about how to file a civil rights or privacy complaint with your office?
Sure. So yes, we have a complaints portal. If you go to HHS.gov/OCR, it will literally teach you how to file a complaint if you don't know how. I think a lot of people get intimidated by that. It's not a legal brief. It's not some big, thing. I mean, it can be, but it doesn't have to be. You could literally file a complaint in the back of a napkin. And so this complaint portal is now in 15 languages, which we've just updated, and it has gender neutral honorifics so that we are honoring our community, especially as we think about our non-binary, gender non-conforming siblings across the country. On privacy side, I like to remind folks that you continue to have a right of access to your medical records. That's not a gray area. That's very straightforward. And if that's something you feel like you're not being able to get your records, you're not getting at a reasonable cost, it's being unnecessarily delayed, you can file a complaint with the Office for Civil Rights. It's just something we think is really important to empower patients that they have access to their medical records as well. And that can also be done on our HIPAA page, which is just hhs.gov/HIPAA.
Well, thank you for that really important information for our community. So, of course, it's Pride Month. Tell me what Pride means to you.
I appreciate you asking that and the significance of you asking me that. You and I talk a lot about the glass ceilings that you have helped shatter, that I have helped, not shatter, but help to make space for other people. And I think it's really important to occupy that space. So thank you for inviting me for that. For me, it's a reminder of two things. One, pride is joy. And I think a lot of people feel really proud about who they are and that they can celebrate that in communities across the country. But Pride also started as a riot, and it was a fight for equality. And as a civil rights office, that is what it means for me. I mean, we've made a lot of progress, but we still have a long ways to go. And so it's about standing up and fighting and standing up as an ally and standing up and doing all that we can to make sure that no matter where you are in this country, no matter who you are, no matter what kind of healthcare it is, you can access it and not be treated poorly and access it in a way that you feel equality.
Well, thank you so much for your thoughts about Pride. You know, we have a strong and resilient community that fights hate with love. And it's so important to remember that we have come a long way, but we have a long way to go. So thank you so much for joining us here today for this conversation. And remember, we are stronger together, and it's all about pride.
Produced by the U.S. Department of Health and Human Services.